So working with someone that was having a lot of knee pain, just moving around and pivoting, kind of living their life, they would get a sharp pain kind of randomly in their knee. Sometimes it lingered, and sometimes it just kind of came out of nowhere for them. So in this case, what we did was just figure out if they could extend their knee, no pain, and if their knee was able to overcome resistance. So I just put some weight on here, and they were totally fine with that. Compared to the other side did the same thing, was fine, but it felt stronger. So I put a TENS unit on them just to kind of force the quad to work more. And then we retested them again, and then their quad felt much stronger. So that was helpful for them. They kind of felt normal through their leg, and we just kind of had to teach them how to bear weight on their leg. So we started with just a regular bridge, working on just slowly putting more weight on their leg, and they felt good about that. Eventually, we ended up working towards a single leg, and of course, they could feel their hamstring and butt, but the idea for them was to teach them how to start to bear more and more load on that leg, and of course the knee, and they felt good about that. We also ended up working on a small little wall squat here, making sure they weren't going into a realm or a depth of knee pain. We're just, once they felt their quads turn on, we just kind of stopped there, and they were just working on trying to ignite and contract those quad muscles even more. And they started at 10 seconds, working their way up to 30 seconds. And eventually they felt comfortable going a little bit lower. But again, trying to teach them how to bear weight and feel comfortable with that. We ended up going through a step up here. We didn't step up, we just had them work on transition in the beginning. So just transitioning, they have all their weight on the back leg, transitioning forward and having them search for that leg muscle and making sure that they weren't feeling any pain or discomfort. Same thing, we had them hold that there, starting at 10, working their way up to 30 seconds. Eventually they felt confident enough to stand up and they were pain-free. So I hope some of those strategies help you. Of course, if you have any questions, let me know.